The National Health Service is to create 244 new posts involved with diversity and inclusion. This despite the fact the NHS has been told to cut down on waste and wokery. Now, when it comes to the D&I agenda, as it's described, it's one of the main reasons that I was debanked by Coots. Yes, absolutely. You see, I didn't align with their values. In the world of these people, job opportunities, job placements are all about targets. Targets based on race, sexuality, gender, and many other things. Ability, it would seem, has almost nothing to do with it, and it's why I'm so against it. But we are GB News, and we believe you should hear all sides of the argument. And you're about to, because Alyson Malach is Director of Equality and Diversity UK and joins me live down the line right now. Alyson, welcome to the programme. Tell me, how will it benefit a National Health Service with a waiting list of 7.7 million people waiting for medical procedures? How will it help them if we employ 244 more inclusion and diversity officers?
I think we've got to think about the context, and the context is that within those 7.7 million people, there's diversity, and currently a lot of people are not having equitable services, and therefore, because they're not having those equitable services, they are claiming against the National Health Service and costing them money again. So it's better that we think about the context, we think about what the needs are and the intersectionality within those groups, and that we plan to deliver. The equality and diversity is not just a buzzword, it really is about the principles within there as well.
Sorry, intersectionality. I'm guessing most of the audience will never have heard of the word. What does it actually mean?
Well, I'll give you a classic example, is that I'm of a different race. I'm also a woman. I'm a woman of a particular age. I've also got disabilities. All of those are intersectional. And expecting services from the National Health Service, I need to think about what my disability needs are, what my sex needs are, what my race needs are, all of those things. And quite often we've got people who have got conscious and unconscious biases who are in the workforce working alongside the patients, and sometimes the way that they behave and the things that happen is not necessarily good for the patient or good for the hospitals themselves. So having those people in place will help. And remember that part of that number that you've used is about those people, that diversity and differences within there as well.
See, but I can't think, Alyson, of a more diverse employment organisation than the NHS. Because it seems to me that lots of young British doctors and nurses emigrate, go to other countries, get paid a lot more money and work shorter hours and have better conditions, and that actually the NHS has taken in people from all over the world, from the most diverse range of backgrounds. Frankly, aren't we just spending good money after bad? Isn't this already as diverse an organisation as it possibly could be?
Yeah, you can have diversity without fairness. And, you know, the statistics are 1 in 3 people who are ethnically diverse are discriminated against, and that's staff within the NHS, as opposed to 1 in 5 people who are white individuals. So, you know, that diversity, just having the diversity there, and that does not mean that equity exists and inclusion exists and belonging exists, and we've got to change that.
Wouldn't it be better, Alyson, to live in a world where we treat everybody equally? We really don't give a damn what their sex or gender or race is. We're not interested at all. We just treat them as human beings and do our absolute best to treat everybody equally. Wouldn't that be a better, fairer, and really a far sounder way for us to live?
Yeah, I think that when you say it like that, I think about people with disabilities. And, you know, if you're in a wheelchair, treating everybody the same doesn't work for you. And, you know, if you've got dyslexia or neurodiversity, that doesn't work for you. So you need to think about those individuals as individuals and tailor your services to their needs as well. And sometimes that's not happening. It's one size fits all. And it's really important that that begins to happen.
Well, I wonder whether we can afford all of these things. But Alyson, thank you for joining me on the programme and putting your point of view. Thank you very much. Well, there you are. As I said, it's GB News, and we hear all points of view.